YouTubers. Thank you guys so much for joining me today. I hope you are well and feeling healthy, as you can tell by the title of this video. I will be covering why prenatal care is important and what you should expect during your first prenatal care visit. Conception and pregnancy is a very important and crucial time in a woman's life. Any steps during this process that can reduce the mother's stress level is a very good thing and highly recommended by most healthcare professionals. Regular prenatal care visits can help put the new mother's mind at ease and help verify that both the mom and baby are healthy and that the pregnancy is progressing normally and properly, which directly reduces the stress level of the mother. Without regular scheduled prenatal care, you are at risk for developing maternal and fetal complications that can result in injury or even death to both the mother and the baby. So let's quickly go over what to expect during your first prenatal care visit. You should call to schedule your first examination during the first 6 to 8 weeks of your pregnancy, or when your menstrual period is at least 2 to 4 weeks late. Many healthcare providers will not schedule the first visit before 8 weeks gestation. But most women schedule their first prenatal visit within 2 weeks of a positive home pregnancy test, or within 3 to 4 weeks from the start of them realizing that they're having pregnancy symptoms, to confirm that the pregnancy is viable and that it is inside of the uterus. So during your first visit, you'll be asked a lot of questions about your health and your habits that may have an effect on your pregnancy. It is important to answer these questions as honestly as you can and to evaluate your lifestyle realistically. It is also important to try to remember the date of your last menstrual period so that the doctor can make sure the pregnancy is progressing properly and at the normal rate, and so that they can give you a correct, the most correct estimated due date or predicted due date. During this first visit, you can expect to have a full examination, including a pelvic and rectal exam. A blood sample will be taken and used for a series of tests, including a complete blood count, blood typing, screening for Rh antibodies, screening for infections, check for evidence of previous exposure to chickenpox, measles, mumps, and German measles, and check for cystic fibrosis. During your first visit, you can also expect to provide a urine sample for testing and to have a pap test or smear to screen for cervical cancer. Now, if you've had a pap smear within the last 6 months to a year from the time that you got pregnant, your doctor may decide not to do a pap smear. But if your results were inconclusive, or if they were not normal, then your doctor will most likely want to do another pap smear at the time that you are confirmed pregnant, just to make sure. Now that we briefly went over what to expect during your first visit, let's go over what will be overlooked or compromised when a woman decides to not get regular prenatal care from a doctor, OBGYN, or midwife. Now, there is a huge list of reasons and risks you take when you do not get seen by a doctor, OBGYN, or midwife for the duration of your entire pregnancy. Not seeing a doctor in the first or in the third trimester is when you do run the biggest risk. Now, I do want to note, this is very important. I'm not saying you are a bad mother if you don't receive regular prenatal care, or if you've decided not to receive regular prenatal care from a doctor or midwife. I'm simply going to go over the what ifs and possibilities that can occur if you do not choose to see a doctor or midwife during your pregnancy. So let's go over these very real risks and possibilities. When you decide to not see a doctor or midwife for regular prenatal care, you have an increased risk of preterm birth, an increased risk of pregnancy occurring outside of the uterus, increased risk of fetal complications such as placental abruption, placental ectasia, and low-lying placenta. You increase the risk of umbilical cord complications, increased risk of retained placenta after birth, high risk of too little or too much amniotic fluid. If you do not receive regular prenatal care during your pregnancy, you have a higher risk of low oxygenation through placental maternal distribution. You increase the risk of hormone imbalance. You also increase the risk of uterine complications such as an incarcerated uterus or a diseased uterus. Increase the risk of uterus not getting enough oxygen. Increase the risk of post-term birth. You increase the risk of a post-term birth. There is a way of safely prolonging a labor, and if you are not getting regular prenatal care, you are not able to monitor your and baby's health in prolonging the labor. So you run the risk when you don't receive regular prenatal care that you run the risk of having a post-term birth, which can complicate and compromise both your and the baby's health. If you do not receive regular prenatal care, you have a higher risk of developing diabetes during early or late pregnancy, a higher risk of developing infection related to complications during pregnancy. You have a higher risk of developing infection-related complications during delivery. You have an increased risk of developing preeclampsia or eclampsia during your pregnancy or during your labor and delivery. If you do not receive regular prenatal care, you have a higher risk of complications related to Rh antibodies during delivery, known as Rh incompatibility. You have a higher risk of a missed miscarriage. You increase the risk of exacerbating symptoms in a pre-existing condition or illness due to pregnancy hormones, weight gain, or stress, not getting enough sleep, or not getting the required medical treatment. If you do not receive regular prenatal care, you have a higher risk of missing a cancer diagnosis in early or late pregnancy. You have a higher risk to fetal health in first trimester due to lack of possible diagnosis such as fetal nucleol translucency. You increase the risk to fetal health in second trimester due to lack of possible diagnosis of spina bifida and Down syndrome. You have a higher risk of overlooking diagnosis such as arrested development. You have the extremely high risk of a stillborn birth, increased risk of labor and delivery complications due to not being aware of how many babies are in the uterus, having no record of the last known position of this baby or babies, or the size of the baby or babies. You have a higher risk of maternal nutrient deficiency and baby having a low birth weight because of this. If you do not receive regular prenatal care, you have a higher risk of developing postpartum depression, anxiety, or a mood disorder due to hormone imbalance and nutrient deficiency during your pregnancy as well as after your pregnancy. You have a higher risk of pregnancy denial or hiding the pregnancy altogether. If you do not receive regular prenatal care, you're at higher risk of ignoring or not bonding with the baby after it's born due to lack of education. You increase the risk of gaining too much weight or too little weight during pregnancy. You increase the risk of foodborne illness during pregnancy. You increase the risk of high toxin overload, which can have detrimental effects on the fetus's health and future. If you do not receive regular prenatal care, you increase the risk to your own future fertility and conception. You increase risk in future reproductive health. You increase the risk of feeling like an insufficient mother or guardian due to not receiving regular prenatal care and not preventing complications from arising. If you do not receive regular prenatal care, you're at higher risk of baby feeling unwanted during a pregnancy while they are in utero. A higher risk of mother developing a disease during pregnancy that does not reconcile after baby is born, for example, diabetes. You're at higher risk of mother having to live with long-term complications after the birth of the baby. You're at higher risk of baby having to live with long-term complications after its birth due to the many decisions the mother made during pregnancy. If you do not receive regular prenatal care, you increase your risk of developing post-traumatic stress disorder due to the pregnancy itself or during the labor and delivery process, not feeling prepared or not being prepared as a mother or as a woman during your labor and delivery. If you do not receive regular prenatal care, you increase the risk of a real cryptic pregnancy, not finding out you are pregnant until your 20 weeks gestation or more. Now, someone who does not go in for prenatal care or monitoring or to go in to make sure that the pregnancy is viable, this person is at a higher risk for developing a phantom pregnancy, a false pregnancy, or a delusion of pregnancy. Also, when you do not go in for regular prenatal care visits, you have to navigate through your own symptoms yourself with no assistance, no prescriptions, to help ease the discomfort and signs and symptoms of pregnancy, such as extreme nausea and vomiting. Without prenatal care visits, you do not get any assistance with helping ease these sometimes debilitating symptoms. Also, you may not have any help in determining if the signs and symptoms you are experiencing are normal, if you should be monitoring these symptoms, and what is safe to do to help ease the discomfort, and what signs you should never ignore during your pregnancy. It is also important to note that if you do not receive regular prenatal care, that you are watched and monitored more closely by the hospital and hospital staff after your baby is born. Not receiving regular prenatal care makes hospital staff and healthcare professionals nervous about the mother's and the baby's health and outcome. Not having a medical background on the woman in this particular pregnancy makes it difficult for the providers and nurses to diagnose and treat a pregnant woman when possible complications arise during pregnancy, labor, and delivery. Not having a medical history can prolong diagnosis, complicating the treatment, further compromising the mother and the baby's health. Now again, I'm not condemning this lifestyle or way of pregnancy. Not receiving regular prenatal care in some cultures and traditions is completely normal. It depends on the individual woman's health and education level. I do want to note that for the average woman who was not thoroughly researched and educated on pregnancy, labor, childbirth, that these risks are very real and should be addressed by each individual mother for each individual pregnancy. Now, I personally highly recommend receiving regular prenatal care from a healthcare provider, a midwife, a nurse practitioner. If you're healthy and there is no complicating factors, you can expect to see your healthcare provider during your pregnancy every 4 weeks until the 28th week of pregnancy. Then you'll see your healthcare provider every 2 weeks until 36 weeks of pregnancy, and then you'll see them once a week until delivery. That's not so hard. The education you receive during these prenatal care visits is important in a healthy pregnancy, a labor and delivery, and in motherhood in general. The resources available to you during these visits should not be overlooked. Resources not only about conception, pregnancy, labor, and childbirth, but also education on breastfeeding, pumping, skin to skin, options for pregnancy comfort and flexibility, bonding with your baby after it's born, mothering education, nutrition education, social and economic support, baby wearing information, daycare, resources, domestic violence education, support and awareness. Prenatal care appointments supplies you with the opportunity to discuss your mental wellness, your physical wellness, your emotional wellness, and social wellness with a professional during and after your pregnancy. This is healthy. It gives you the resources to openly discuss your anxieties, worries, and fears about your pregnancy, about labor, and about childbirth. It gives you the options to discuss what kind of birth you want as a woman, as a mother, especially to first-time mothers. This information is irreplaceable and priceless. Between the professionals themselves and the other pregnant women you will meet in the office waiting room, you have an abundance of information, education, and hands-on experience to explore during each prenatal care visit. It's exciting. Pregnancy should be a joyous time, so do what feels right to you, for your body, for your baby, in your pregnancy. Just remember, you are responsible for the decisions or lack of decisions you make on behalf of your baby or babies in your belly. It is important to remember that your baby inadvertently pays for your decisions in your pregnancy. So take care of yourself. Talk to your healthcare provider before getting pregnant about how you can best prepare your body for pregnancy. And if you're already pregnant, try to make the best choices possible for you and your baby. Choose to eat healthy foods, exercise, stay away from stress, quit smoking, or at least cut back. And see a provider throughout your entire pregnancy. Don't be afraid to ask them questions. If you need help, ask people for it. Don't be afraid to tell these professionals what you need. So thank you guys so much for watching this video. I hope this helps someone figure out the risks involved with not receiving regular prenatal care and how your decisions during pregnancy affect your baby. So have a great day. Be well, be healthy, stay blessed, friends. Bye.